So, could you be allergic to your partner's semen? Not just having a sneeze when they ejaculate, but a real allergy. If you are, how do you find out if that is the case and what can you do about it? In the next few minutes, we're going to talk a little bit more about semen allergy, how to find out if you've got it and how to treat it. I'm Simon Snook, the Kiwi Sex Doctor, and on this channel we give you tips, tricks and hacks for a better sex life. Semen allergy is probably a little bit more common than we think. To illustrate it, a really common story was like a patient who came to see me the other week. Her name's Kate, and essentially the story was this. She was in her mid-20s and had been having sex for a number of years and had been with her most recent partner for about the last 6 months. She'd never really had any issues with sex. It had always been fine, enjoyable and without any discomfort or anything. But after a couple of months of being with her new partner, they decided to move their birth control from using condoms to using another form of contraception, a hormonal contraceptive that she was using. And at that stage, she stopped using condoms. And she noticed almost immediately that sex was fine during sex, but at the end and after sex, she started to feel really quite sore and itchy in the vaginal area. And this went on for many, many minutes and really was quite uncomfortable. And it occurred to her that this really essentially only occurred if he ejaculated inside of her. If they went back to using a condom or if he withdrew before ejaculating, there was no pain. And she came to the clinic wondering what was going on and in herself wondering whether in some way she was allergic to semen or whether that was even possible. Well, that story is absolutely classic. And I'll talk to you now a bit more about what semen allergy is. Human beings can develop allergies to virtually anything or anything with a protein base in it anyway. And we all know the common allergies: dog, cats, hay fever, those sorts of things. And what happens is our immune systems pick up a protein in the environment, for instance in pollen, and see it as something harmful and launch some sort of attack against it, which has its own effects on our body. In other words, an attack against pollen, our immune system floods our nasal mucosa, our eyes, our throat, gives us runny nose, itchy eyes, sore throat, etc. Semen is exactly the same. Semen contains proteins, and it's therefore possible to develop an allergic reaction to the protein within semen. And depending on where that semen is left on the body, you can get an allergic reaction in that place. So in the story I said earlier, essentially what Kate was noticing was that an ejaculation inside her vagina caused the vaginal mucosa to get red and itchy and swollen and sore. That was the immune reaction, the allergy to the semen left there. But that same sort of allergy can be felt anywhere where semen is left on the body, in the throat, in the anus, in the vagina, even on the skin, although often the skin being a bit thicker is a bit less sensitive. Thankfully, it's very rare to get an anaphylactic reaction to semen. Anaphylaxis can be a serious allergic reaction which takes over the whole body, can cause problems with breathing, can cause blood pressure drop, can cause collapse and in some cases death. And thankfully, that's extremely rare with the semen. However, the local reactions can be severe and in many cases can get in the way of having sex at all, or at least sex to completion and ejaculation, which in the case of my client, Kate, that I'm talking about, was becoming an issue because they were thinking it was time to maybe start a family. But for Kate to allow her partner to ejaculate inside her vagina would lead to quite severe burning and soreness afterwards and really made the whole experience very unpleasant. So often the diagnosis of semen allergy is pretty obvious. If there's an ejaculate in the area and then it gets sore, itchy or red, and if the ejaculate isn't in the area, that doesn't happen, then you're probably allergic to the ejaculate. But you can test to be 100% sure. We use these things called skin tests or skin prick tests, where essentially you put a small amount of semen on the skin and just pop a needle just to break the surface of the skin, and then right next to it do a control test with a bit of pure water. And of course, if you're allergic to the semen, that area of skin where you've pricked it will become red and swollen. What's interesting about semen allergy is that in many cases, the allergy is only related to one specific partner. We all have different DNA, our whole body is made up different, that's why we look different, and our semen also has different proteins from person to person. Therefore, you may be allergic to one man's semen and not another man's. So in some cases, the issue is related to the specific partnership that's going on. Semen allergy with multiple partners is much less common. So, what can you do about it? Well, clearly the simplest thing to do about it is avoid semen. In other words, have sex with condoms or make sure that when the man ejaculates, it's nowhere near your body. But that can get in the way of some of the fun and spontaneity of sex, and it certainly might get in the way if you're trying to conceive a child. So there are other methods to try and help. Now, You can find that taking an antihistamine prior to sex can lessen it. It's not usually hugely effective, but it's so simple it's worth trying. And that would be the same antihistamine you might take for a hay fever allergy or otherwise. The definitive way though to try and get rid of semen allergy is called desensitization. And this should be undertaken with an allergy specialist if you can find one, though it can be quite difficult to find an allergy specialist who has expertise in this area. But essentially the idea is this: if you introduce semen in very, very weak dilutions to the body and slowly build up the strength of it, the immune system kind of gets used to it, and in that way it learns to not have an allergic reaction against it. There are a number of different protocols for doing this, but essentially it works as follows. You would get some of your partner's semen and you would dilute it maybe 100 times in sterile water. So for every 1 ml of semen you add 100 ml of water. You mix it up and you take a 5 ml amount of that and you put it inside the vagina. And if that doesn't itch, that's great. Do that a number of times over a course of a week or so, and then build the strength up. So next time 1 ml of semen to 50 ml of water, so it's twice as strong. Do the same thing. Take 5 ml in a syringe, squirt it inside the vagina. If there's no reaction, that's great. If there's a mild reaction, just keep on going with that amount. And we keep increasing the concentration of the semen, again exposing the body repeatedly at each dose a number of times for a week or a couple of weeks, and then making it more concentrated, so 20 ml of fluid to 1 ml of semen, then the following week 10 ml of sterile water to 1 ml of semen, the next week 5 ml, and eventually 2 to 1, and by then you should be able to accept just normal concentrated semen without the allergy. And that's the whole process. You start from very, very dilute, repeated exposures, and increasing the concentration slowly and slowly and slowly until you get there. So I hope that was some help to you. Please give me a thumbs up if it was, and please do leave some comments if you have any other questions or any other conditions you'd like some advice on. Thanks for watching. The question is, if you have a semen allergy, what can you do about it? Well, it's not an area that's had a lot of